The House Families and Veterans Committee will come to order. Would the clerk please take attendance?
Chair Schmaltz.
Here.
Representatives Wozniak.
Here.
Fox.
Present.
Johnson.
Here.
Thompson. Pavlo.
Here.
Wolford.
Present.
Young.
Here.
Burns.
Here.
Reingen.
Here.
Song.
Present.
Madam Chair, you have 10 members present, a quorum.
Thank you, Mr. Clerk. Representative Johnson moves to adopt the minutes of the September 16th meeting without objection, so ordered. So our first order of business today is to hear testimony from Representative Wozniak on House Concurrent Resolution 1. Rep. Wozniak?
Thank you, Madam Chair, and committee members. Good afternoon. We're going to talk about ACEs, otherwise known as Adverse Childhood Experiences. I've been familiar with this program for about 4 years now. I've seen it progress from a smaller program to going statewide, and now we want to progress another step forward and looking to have some oversight to make sure that it's doing what it's supposed to do. I was going to read the resolution, but it's 2.5 pages long, and you guys would be sleeping by the time I got done with it. So
Go ahead.
I'm
Go ahead, Woz. Go ahead. Read the- Kidding.
I've just got a short introduction. So thank you for the opportunity to speak today in support of the resolution urging the governor to direct state agencies to assess how their programs help reduce adverse child experiences, or ACEs, and to report annually on their progress. ACEs, including abuse, neglect, and household instability, are among the most significant predictors of lifelong health and social outcomes. Nearly 70% of Michigan adults report at least one ACE, and 1 in 5 report 4 or more. These experiences are directly linked to higher rates of depression, chronic disease, and substance use disorders. Personally, I would say that some of the violence we see in our communities today are directly related to ACEs. By requiring agencies to evaluate how their programs impact ACE reduction, this resolution helps ensure our policies are evidence-based and prevention-focused. Public reporting will create transparency and accountability, allowing us to measure progress and invest in what truly works to build a resilient family, group, and communities. Addressing ACEs isn't just about compassion. It's about effective governance and long-term cost savings. Prevention today means fewer health crises, fewer behavioral challenges, and a stronger Michigan tomorrow. I would like to introduce Ms. Lisa Farnham from MAHP Foundation to speak a little bit more and give you some insight as to how ACEs work. Lisa.
Good afternoon, Madam Chair Schmaltz and members of the committee. And thank you for the opportunity to testify in support of House Concurrent Resolution Number 1. And many thanks to Representative Wozniak for sponsoring this important resolution. My name is, he says, Lisa Farnham. I serve as Managing Director for the Michigan Association of Health Plans Foundation. I'll keep my remarks short today, as you already heard detailed testimony earlier this year on the Michigan ACE initiative and its statewide impact. I'd like to give you an example about how learning and education around ACEs can have an impact in community. The Michigan ACE initiative has worked for years to expand trauma-informed understanding across every system that serves Michiganders, including justice, education, and health. The Dearborn Veterans Treatment Court's Creative Arts Innovation Program is a powerful example of this work in practice. By recognizing how trauma, including early life adversity and combat-related experiences, can affect behavior and connection, the court created a safe, expressive space where veterans could heal and reconnect. The outcomes speak for themselves. 100% of program completion and measurable increases in community connection and well-being. These results mirror what our ACES training promotes statewide. When systems are trauma-informed and relationship-centered, individuals are more likely to recover, re-engage, and thrive. Programs like this demonstrate the real-world impact of HCR1's vision, building a Michigan that leads with resilience, understanding, and hope. In closing, I would like to thank you again for recognizing the importance of trauma-informed policy and practices through this concurrent resolution. The work is already happening across Michigan to build resilience, strengthen communities, and improve outcomes for children and families. So thank you for your time again and your leadership in advancing this effort. I'd be more than happy to answer any questions you might have.
Yes, thank you both for your testimony. This is a very important resolution, and we appreciate you bringing it forward. Are there any questions from the committee? Rep. Burns? Go ahead.
Thank you, Chair Schmaltz. Thank you both for your testimony today, and I appreciate the reference to the Dearborn Veterans Court Treatment Program. It's very special and something that we're very proud of. Representative, my question is for you. In the resolution, there's language that refers to administering agencies. Can you tell me more about what your thoughts are with regard to which departments specifically this would impact if it were implemented?
Great question. I think when we look at administrative agencies, it's a catch-all term. But when we look at our school system and the State Board of Education, there are many administrative agencies. So what we're trying to do with this resolution is establish trust but verify to make sure that the programs are working the way they're supposed to. Each school should have some type of social community director that can talk about ACEs. Now, the way this program works in the schools is that it's supposed to be quiet, private, and not let the public know really what's wrong with the child or if there's anything wrong or how they've been affected by an adverse childhood experience. So there isn't a stigma that's going to be attached. So when we have the conversation with the child, we try and make sure that they're going to go on the right path rather than ending up as a serial killer, which is an extreme example. But as far as the administrative agencies, I think there are many, and that's why we want to verify exactly how that's going to be taken care of and not have finger pointing going, it's your responsibility.
Okay. Thank you. And Madam Chair, if I may, just a quick follow-up on that. Thank you. Representative, just for clarification, based on what you just shared, it sounds like this would be school-specific. Am I hearing you right, or would this have a space in other state agencies, state departments? Just want some
No, this is
clarification there.
specifically designed for the education department, our schools,
Okay.
yes.
Okay, thank you for that clarification. I didn't see that language in the resolution, so just maybe a note there for the future as you move forward with this.
We can
Thank
add
you.
it if you feel it's necessary, and we'll take a look at that.
Okay, thank you, Representative.
Thank you.
both.
Rep. Rheingans?
Sorry, I'm like in the no man's land of microphones. So my question is related, I guess, thank you for clarifying that it's only for schools. I didn't realize that because it wasn't really explicit. I am curious if the ACEs you're talking about are traditional or the expanded ACEs that are mentioned by Wade et al. In Pediatrics 2014 study, which include poverty, discrimination, bullying, community violence, migration-related stressors, and foster care involvement. Those are ones that are suggested to be included in expanded ACEs as much as 10 years ago. So are we talking about only the traditional ones of the original population in the 90s that was studied, that was like middle-class white Californians, or do we want to include other studies?
Well, I'll tell you personally, anything that affects a childhood behavior so that it affects them later in life, I would like to see included in here, no matter what it is, because we're trying to affect their life, not just one example of that coming into them that would affect it, but we want to affect their later life so that they become profitable. Right, that's not the right word, but good members of society. You want to add something?
I can add a little bit. When we first began the training, we did focus on the 10 ACEs in the 3 categories. Over probably the past 5 years even, a lot more research has come out around social determinants of health and community violence and things like that. And so our training does now, even though we start with the basis of the 10 ACEs, we do have discussions regarding effects of homelessness and food insecurity and those types of things. So the answer would be yes, we do have those conversations. They just weren't part of the original study.
Thank you again for your testimony. It's always important to protect our children and help them become successful in life, so thank you.
Yeah, like I said, this is a lifelong program, and it's very, very important that we do take care of this.
Are you done?
Did you have?
Okay, Rep. Burns.
Thank you, Madam Chair. I appreciate it. Representative, just a question for you. I know that this resolution is encouraging Governor Whitmer to issue an executive directive around ACEs and incorporating this. Given that the governor will be, term limited out within roughly a year, can you talk to me about what your plan would be for kind of longer term incorporation? Because my understanding is that once the current governor is term limited out, that any executive directive that she in this case would issue would be sunsetted at that time. So can you talk to us just about longevity around this?
Yeah, I would think that we would contact the current governor at that point and make sure that they're aware of the resolution and keep going forward with it. Of course, the administrative agencies that you had asked about would still be going forward, and hopefully they'll be more advanced at that point. Any thoughts? No?
Okay. Thank you.
All right, thank you again for your testimony. Thank you. We have some cards to read in support. Richard Murdoch, R.B. Murdoch Consulting. Crystal DiAgostino, National Kidney Foundation of Michigan. Amy Zagman, Michigan Council for Maternal and Child Health. Colin Ford, Michigan Chapter of the American Academy of Pediatricians. Katie Prout, Michigan Federation for Children and Families. Jacqueline Lenderman, Ashara Shepherd Lane, ASL Educational Consulting. Bart Demeter, CASA. Jessica Camp, Healing Centered Restorative Engagement. Bianca Miles, Christina Shearer, Michigan Association of Health Plans. Angie Flores de Lopez, Amy Stagg, and they are all in support of this resolution. Our next order of business is to adopt an H1 substitute on House Bill 4959. This substitute clarifies renewal fees are not annual, but instead every 3 years. This is part of the guardianship package. Representative Fox moves to adopt the substitute. Mr. Clerk, will you please take the roll?
On the motion to adopt the substitute, Chair Schmaltz,
Yes.
Representatives Wozniak,
Yes.
Fox,
Yay.
Johnson,
Yes.
Thompson, Pavlo,
Yes.
Wolford, Young,
Yes.
Burns,
Yes.
Reingens,
Yes.
Song.
Yes.
Madam Chair, you have 10 yeas, 0 nays, 0 pass. The motion prevails.
Thank you, Mr. Clerk. The substitute is adopted. Next, we'll have testimony on House Bill 4959. This bill just establishes the fee amounts for the licenses that are created under House Bill 4728, again, my guardianship bill. And this is required by the Occupational Code. Are there any questions on this? It's just a technical cleanup. If you have any questions, you can talk to policy afterwards. Okay, next we'll have a presentation from Mike Brandow of Camp Valor. Mike, you can take a seat and press the button for the microphone. Thanks for being here.
Madam Chair, thank you. My name is Mike Brandow. I'm a 3-tour Marine Corps Infantry combat veteran and a current Master of Social Work candidate at Saginaw Valley State University. I'm the founder of Camp Valor Adventure Healing.
Mike, did you push the red button there?
I did.
Okay, push the mic towards you so we can hear you better. There you go.
Can you hear me now?
Yes.
All right.
First of all, tell us where you drove from.
What's that?
Where did you drive from?
Bay City, Michigan.
Yes, thank you so much for being here.
Thank you. As I said, my name is Mike Brandow. I'm a 3-tour Marine Corps Infantry combat veteran and a current Master of Social Work student at Saginaw Valley State University. I'm the founder of Camp Valor, Adventure Healing, Michigan's first and only clinician-led combat veteran-founded nature-based therapy model of serving veterans. The reason I'm here is simple. The war has never ended. It just followed us home. In 2003, my unit fought at the Basra International Airport, securing oil fields, moving through Al Dawanya, Al Afaq, Al Akut, and crossing the Diyala Bridge after a 3-day firefight, entering South Baghdad as some of the first U.S. Marines into the city. I was in Firdos Square when Iraqis pulled down the Saddam Hussein statue. In 2004, we returned to Iraq, fighting in the north near Syria, when our unit was called back to Fallujah after 4 contractors were hung from a bridge. We established an outpost near that bridge and foot patrolled the city for the next 6 months. In 2005, we returned yet again to Fallujah, enduring more daily mortar fire, IED attacks, and small arms attacks as we again foot patrolled the city. Within 8 weeks of coming home in 2003, we started losing men. Suicide, overdose, drunk driving, police shootings, even murder. We survived combat, but we couldn't survive coming home. One of the first to go was a Marine in my unit. He'd make everybody laugh even on a bad day. He survived countless firefights and ended up taking his own life on a training op 2 months later. It was just another moment where we realized the war zone doesn't end, it just changes. The battlefield follows you back home, and if you don't confront it, it will kill you. Michigan is home to over 500,000 veterans. Roughly 7% live with PTSD, over 20% report broader mental health challenges. According to the VA's own statistics, Michigan's veteran suicide rate is higher than most states at 29.3 per 100,000, and even higher in northern rural areas. Please note these numbers only represent veterans in the VA system. Those who've never enrolled, were given up, or self-isolated, are invisible to this data. When you prepare to leave active duty, the Marine Corps offers you a 5-day transitional assistance program called TAPS, which is highly rich in resources, job skills, and work readiness. You won't find the words clinical therapy, group counseling, or trauma anywhere on the website. No clinical staff, no trauma processing, no warm handoff. The unspoken messages don't talk about it. That's why I believe the TAPS model must evolve, and it shouldn't just be a work readiness program, especially when most states have Michigan Works type offices. It needs to be a mental health reintegration week led by clinical professionals. Every service member coming home deserves at least a few days of guided decompression, trauma screening, and clinician-facilitated discussion before they re-enter civilian life. The first conversations about trauma shouldn't be should happen on a plane, not years later in a VA waiting room. After 3 combat tours, I wasn't even shown a breathing exercise to relax. When I did finally walk into a VA in Chicago, they told me I was one of the first OIF veterans they'd seen. They actually didn't believe me. They'd asked if I had actually ever fired my rifle, as if Fallujah had been a training exercise. The system wasn't ready then, and in many ways it's still not. Only 12% of U.S. veterans are actively engaged in any form of mental health right now. That means nearly 9 out of 10 are carrying invisible wounds untreated until they break. And that's a scary number considering OIF veterans on average are in their mid-40s. We've seen the cost of untreated wounds in real time in just the past few weeks here in Michigan and the nation. The heartbreaking shooting in Grand Blanc and the incident in North Carolina, both perpetrated by Marines committing terrible acts in our country. These aren't isolated incidents. It's evidence that the system is broken and it's waiting for a crisis to happen before any action is taken. Each headline is a warning sign that we need prevention, early intervention, and clinical presence long before that breaking point. These numbers are not abstract to me. My infantry unit is facing what I can only describe as a suicide epidemic. At this point, we've lost more Marines to suicide than to actual combat. One of the main reasons I entered the social work program was last year we lost a Marine. He was a leader. He had a family, a wife. He was a government employee. He had a house, a white picket fence, and he committed suicide. That thwarted me into action to join the clinical social work program. And even then, in the social work program, a veteran committed suicide. A woman who was doing everything right, pursuing her degree, showing up for class and rebuilding, lost her own battle with invisible wounds. It's a stark reminder to me that the crisis isn't out there, it's right here, in our schools and in our community. And even in the next generation of social workers trying to make their own right. Although hard data is still limited right now, we're seeing a troubling trend. Many service members today who die by suicide never even served in active combat zones. Despite this growing number of recreational programs offering hunting and fishing trips, the suicide rate continues to rise. This shows that recreation alone isn't enough, and what's missing is true clinical intervention and purpose-driven healing in nature. Why Camp Valor? Because I've seen what happens when we get it right. At Bay Veterans Foundation in Bay City, I've witnessed Vietnam veterans working shoulder to shoulder in a workshop. As clinicians in training, I see therapy taking place in real time. Veterans sanding wood, telling stories, helping younger vets fix projects, and sharing personal stories of their military experience they wouldn't share inside a therapy room at the VA. It's not labeled therapy right now, but it's everything therapy is meant to be. Today we have a partnership with the Saginaw VA where they bring residential veterans to the foundation for special projects at least once a month. What's really happening here is trauma work through purpose and connection. Working as a crisis counselor at Bay Veterans Foundation confirmed the foundation of my model for Camp Valor. A blend of hands-on purpose, peer connection, and clinical structure in a natural environment. And let's be honest, if I asked you guys to close your eyes and envision a place where you're going to share your trauma, would any of you envision a cinder block room, 10 by 10 with a dingy ceiling? I wouldn't. Unlike recreational retreats that focus on hunting and fishing weekends or outdoor recreational activities, Camp Valor is a licensed clinical therapy program in the natural environment. Therapists provide trauma-focused, CBT, solution-focused family therapy and other modalities while participating and engaging in structured activities like hiking, kayaking, equine therapy, and woodworking. The foundation of this model is based in evidence-backed clinical therapy in nature. It's the blueprint. While many recreational programs are doing amazing things for veterans, they attempt to offer therapy as an afterthought or a hired guest for a small presentation on mental health. The two problems with this model are, first, the veterans attend these for hunting and fishing trips, and that's exactly what they are, recreational activity, not clinical therapy. So when you go on these trips, and I've been on several, you expect recreation, and it's odd and even forced when you have to sit through a therapy session that you really don't want to be at. Many veterans just go for the hunting and fishing, not the counseling. The experience is great for a few days, but it's temporary escape. They get a 3-day break from whatever problems they have, and then go right back to them without any new tools or strategies to improve their life. And when therapy becomes an afterthought instead of the focus, participants aren't invested in the process. Real healing cannot take place. Camp Valor is a nature-based clinical therapy, not recreation. Veterans coming here know the mission is to improve their mental health status through clinical intervention in a nature-based setting. This program is unique because I stand on both sides of the healing equation, the lived experience of a combat veteran and the personal expertise of a clinician. In the last 2 years of my research, I haven't found another organization in the country where the founder encompasses both. This combination ensures cultural competence and clinical integrity at the core of the mission. For me personally, nature was therapy. Before I ever saw a counselor, I found peace and quiet, fishing on a riverbank, walking in the woods, or working in a workshop. I didn't know it was therapy then, but it gave me strength and focus. And as others have said today, healing doesn't stop with the veteran. Trauma ripples through the entire family. Veterans face one of the highest divorce rates in the country, and studies by military behavioral health show that family-inclusive therapy can reduce veteran suicide by 25% or more. That's why Camp Valor is designed as a family-style therapeutic resort where spouses and children are not bystanders, but they're part of the healing journey. For my own family, this truth is personal. On weekends, we usually head north to Houghton and Higgins Lake, where we camp, kayak, and hike, and spend time around the fire. Shared moments in nature keep us grounded and connected. I have a small group of veterans in the area we serve, and as the beta test for Camp Valor, we meet once or twice a month for hiking and kayaking trips, where I integrate emotional interviewing and solution-focused therapy techniques. These sessions take place in motion, using the group's natural rhythm and conversation for therapy process itself. Barriers and bureaucracy. While this form of therapy is billable under Medicaid and VA community care, there's no clear state or federal guidelines for nature-based clinical delivery. Claims are often denied and misclassified as recreational. Medicaid allows community-based therapy only when medically necessary, but without explicit policy recognition, providers and programs face endless barriers. I've lived that personally as well with the VA. Denied care, redirected, dismissed, until I became the squeaky wheel. I fought through appeals, found a patient advocate, and got what I needed. Most veterans don't have that fight left. Many give up, and that's why we hear veterans committing suicide in parking lots. This is where I believe Michigan can lead. We have an opportunity to create a state-level framework that validates and supports this model of care, bridging recreation and therapy into a defined clinical category. Formal recognition of nature-based clinical therapy coordinated with appropriate state agencies to establish language recognized for nature-based clinical therapy, pilot program or grant designation, create a 2-year pilot program partnered with Saginaw Valley State University and state agencies to evaluate outcomes, symptom reduction, and family cohesion and suicide prevention, cross-agency collaboration, coordinate between state agencies and DNR to leverage underused state park properties for therapy programs. Veterans already have free park access. The next step is enabling therapy in those spaces. Provider certification pathway. Michigan, in partnership with SVSU, can establish a learning track for clinicians in nature-based therapy. Data collection and reporting require data tracking for all state-funded veteran therapy programs, focusing on outcomes, not just participation. Rethink the model of care. I think this is where we can make a big difference. Rethink the model of care, offering evidence-based therapy as an alternative to institutional care. Pilot program, establish a collaboration with Grand Rapids Veteran Home and Camp Valor to bring inpatient veterans to at least a 1-week nature-based intensive therapy sessions integrated in clinical treatment with outdoor healing and family recognition. National Guard pilot program, by designating a small-scale pilot program for the National Guard and Reserve members returning from deployment or preparing for discharge, we can implement nature-based clinical therapy before separation. The proactive model prevents a crisis before it starts and keeps service members connected to the care network during their transition back to civilian life. Michigan can become the national template for early intervention through the GUARD system. This program would replace the current TAPS model, which focuses on job readiness but ignores mental health and wellness. The goal is to provide every service member, Guard, Reserve, and active duty returning to Michigan a structured transition week that includes trauma screening, family education, daily therapeutic sessions led by licensed clinicians, and master-level students who may need clinical hours in partnerships with state universities. This really isn't about employment readiness. It's about life readiness, making sure the men and women come home prepared to heal and not just work. Number 8, which I believe is more of a federal issue, but you're the best people to bring it to attention. The biggest gap I've identified in the current system is once veterans receive a PTSD rating from the VA, there's no further requirement for treatment. So once a vet receives their treatment or receives their disability rating for PTSD, they're not required to attend any treatment anymore. No therapy, no group sessions, just once a month. Excuse you. They have to attend a once a month check-in with their primary care physician. So we're compensating trauma and we're not healing it. I'm asking this committee to work with state agencies to explore state-level initiatives that incentivize therapeutic participation for veterans receiving PTSD-related benefits, whether through the VA community care programs like Camp Valor. Recovery shouldn't end with a diagnosis. It should begin here. As I said, I believe this is a federal policy issue, but you're the best people to bring aware. Veteran-led outdoor organizations are multiplying regularly because veterans intuitively know that being outdoors heals. But without a clinical therapy foundation, those benefits fade once they return home. Camp Valor is an outdoor activity. Outdoor activity is not the end, it's the means. Clinicians are embedded so that the moments of relief become genuine, sustained healing. The approach doesn't replace the VA, it complements it. In most recreation programs, the activity itself, a fishing trip, a hunting weekend, or a hike is the goal. The day ends and the temporary relief fades. At Camp Valor, the activity is not the reward, it's the vehicle. Each experience is structured, intentional, and therapeutically directed towards an outcome. Whether it's kayaking, woodworking, or hiking, the outdoor environment becomes the treatment room, and the movement, conversation, and connection become the intervention. The result isn't just recreation, it's measurable progress in mood regulation, social connection, and family healing. Veterans leave with real tools they can use in life, and they get continued follow-up through monthly support with vet-to-vet support groups and other available counseling options. Since 2007, I've personally helped over 300 veterans navigate disability claims, mental health appeals, and treatment access. One person can only do so much. Camp Valor represents a system designed to multiply the impact. I currently have written support from Saginaw Valley State University, Bay Veterans Foundation, and potentially another state university I'm talking to. We have the model, we just need the policy environment that clears the path for this kind of care to thrive. Michigan can become a national leader in veteran health, not by building more clinics, but by redefining what therapy can look like. A veteran shouldn't be limited to sterile office environments when true peace and healing can be found in nature. At Camp Valor, therapy happens in nature. It happens while walking a trail, kayaking the river, or even doing a family scavenger hunt in the woods. This is not recreational therapy, it's clinical therapy. Healing through evidence-based nature therapy that restores connection to self, family, and the community. Madam Chair, members of the committee, thank you for your time and your service to Michigan veterans. Our veterans are not broken. They are waiting to reconnect to purpose, to family, and to life itself. At Camp Valor, it's a return to purpose, to peace, and to self. With your leadership, Michigan can be the first state in the nation to recognize clinician-led nature-based therapy as a vital component to veteran care. Thank you for the opportunity.
Thank you so much, Mike, for being here. Your testimony is so important. We cannot express our gratitude enough for what you've been through, how you fought for our freedom, and just everything you went through. And I really wish there was more help for you when you got back here, and that's what we're here for. We want to make sure that the help is there. I think your concept of Camp Valor is wonderful. As we know, veterans helping veterans, they know what's best in this area, so I appreciate you being here. Can you let me know a little bit more about where you are with Camp Valor and how we can help you?
So currently, Camp Valor is partnered with Bay Veterans Foundation in Bay City. So that's really where my home office is at. And then in Roscommon County on the weekends, that's where I go and meet vets to do hikes in the woods and whatnot. In Bay City, it's really city walks. Bay Veterans Foundation, if any of you have been there, I'm not sure. It's located downtown, so it's not really in nature per se, but we do have a nice boardwalk on the river. So right now I'm in collaboration with them, utilizing their facility to conduct therapy services until I have my own property.
And you'd like to put something in Houghton Lake, around the Houghton Lake area?
I believe that would be ideal because it's close to Camp Grayling. And it's a wonderful place in nature, I believe.
Yeah, yeah, no, it's great up there. I thank you so much for what you're doing, and we will, as I talked to you from the beginning, when you called and talked about this, we'll continue to have conversations to see what we can do to help you out. Recreation is so important, as we know, for our veterans, and as you said, just being in a clinical setting inside a building doesn't help a lot of people. So we appreciate you being here for that.
Thank you.
And we do have a question, Rep. Wolford.
Hey, Devil Dog, appreciate you. Thanks for being here today. I'm a Marine, my wife and my daughter. I just wanted to say thank you for every tear that you shed, every moment that you lost with your family, every meal, Christmas, Thanksgiving, hearing of your 3 deployments, the time that you were gone. I love you, man. I'm proud of you. Thank you for being a man of passion and sharing what you're doing. And, Semper Fi.
Thank you.
Appreciate you. Oh, my question was, you mentioned that in Michigan, there's a higher rate of suicide. Why do you think that is? Not that you need to have an answer, but I just...
You know, the why of the suicide is why I'm here.
Right.
I don't know.
Right.
I don't know if we'll ever find an answer to that question. Veterans have options. I'm not here because we don't have options. We have lots of options. There's lots of funding, but there's a huge group of veterans that are being missed, and most of the things that we see right now, if you go on a hunting or fishing trip, the veterans that are there don't need help. They're good. They might have some normal problems, but the veterans that have mental health issues are not going there. You're not going to find them there. You're going to find them at a bar, bottom of a barrel, in the woods. They're not going to be going to the resource center asking for help. I promise that. They're not. We have to find them, or we'll see more incidents like we do.
Thank you.
Thank you, Rep. Wolford. I think one of the main things that you talked about here, we have to keep track of our veterans. We have to have a better system of keeping track of our veterans and being able to talk with them, find out how they're doing. That's a system we really do need to work on it and help. And of course, the transition from when you get back here to civilian life. I think this is a great program. I'd like to work with you further. I'd like to recognize Vinny, my legislative director, is also Marine Reserve, along with Rep. Wolford. So we thank all of you for your service. Thank you so much for being here. I appreciate it so much. I know you drove a long way, and we didn't have the committee for a while, so we kept having to change it. But I wanted to make sure everyone was here so they could hear you and hear what you're doing, and we will get together and try and make this happen. So thank you again,
All right.
Mike.
Thank you, ma'am.
Rep. Pavlov moves to excuse absent members. Without objection, so ordered. There being no further business before the committee will stand adjourned.